Hi, this is Leslie Thompson reporting from the 2009 annual meeting of the American Society for Aesthetic Plastic Surgery in Las Vegas, Nevada. I'm here with Dr. Dan Mills, who is a plastic surgeon in private practice in Laguna Beach, California. The Aesthetic Plastic Surgical Institute is the name of his practice, and Dr. Mills has 20 years in practice. He's on the teaching staff at Loma Linda University for plastic surgery. He's the immediate past president of the California Society of Plastic Surgeons, and you have a whole roster of other credentials to your name. So thank you, first of all, Dr. Mills, for taking time to speak with us today.
Thank you very much for having me.
And we are thrilled to have you. I wanted to talk to you a little bit about, in general, how somebody finds a qualified plastic surgeon. We have a lot of viewers particularly interested in, for example, in breast augmentation. Where do they even start in terms of finding a plastic surgeon who would really be best suited to that procedure?
Well, today is totally different than it used to be. It used to be you'd look through the yellow pages, and that's a dying thing. So people are so savvy on the internet today that you search people out through that. That's one good way. I think it's also good to ask your physician, your family practice or physicians in the area for somebody that has a good reputation. You also want to have met some of the patients, and a good patient referral from somebody in the area is another wonderful way to make sure that you're cross-checking. You're cross-checking the ways of getting to a good plastic surgeon. The most important is when you're looking up their credentials. There's 70,000 people calling themselves plastic surgeons and only about 6,000 to 7,000 board certified plastic surgeons. So you need to ask about their board certification, make sure that they're board certified in plastic surgery. There are people that can be board certified but not in necessarily plastic surgery.
So it could be board certified in cosmetic surgery is something very different.
Totally different, and usually designates that they're a dermatologist or a OBGYN, that type of a organization. I think it's key that if they're a member of the American Society for Aesthetic Plastic Surgery, or a member of the American Society of Plastic Surgeons, you have to be board certified in plastic surgery to be part of that organization. Or in California, to be part of the California Society of Plastic Surgeons as well. All of those organizations are very careful to make sure of somebody's training and so on. The other thing that we didn't talk about is hospital credentials. Hospitals also, you need to ask the plastic surgeon, can you do this surgery at the hospital? Because if you're not a board certified plastic surgeon, very likely they're not going to give you privileges to do them at the hospital because they want to make sure that credentialing is done as well. There are certain physicians who do a preponderance of their work in aesthetic surgery, and that would be somebody that's part of the American Society for Aesthetic Plastic Surgery. That would be very helpful. The other thing is to find out what a physician likes to do, because you could be a member of one of those organizations and do mainly hand surgery. There's some plastic surgeons that like to do rhinoplasties, and they don't do very many breast augmentations. So another good question to ask is, what's the majority of your practice in? What is it in? Body contouring, facelifts, those types of things. And I would say that a preponderance of my work, I do a lot of aesthetic plastic surgery, but a big portion is in breast surgery.
Absolutely. Well, Dr. Mills, thank you very much for your time. Thank you for joining us.
I appreciate it.
And I'm Leslie Thompson, reporting for the Plastic Surgery Channel. Thank you.